I'm Dr. Ava Shamban, board-certified dermatologist from Los Angeles, California. I'm thrilled to be back at Maui Derm 2026, the Maui version, and be part of the most amazing faculty here. This year, as What's My Treatment, I'm presenting a case of Ozempic face. We all have seen so many people have dramatic weight loss, so much so that they always were maybe not that overweight, but maybe just a little chubby, and they've taken it a step too far. Their faces look skeletal and cadaverous. So what are we doing? We're using a combination of the HA gels, formerly known as fillers, to remodel the face, as well as other products such as Renuva and other things such as some of the bioregenerative treatments such as polylactic acid, also known as Sculptra, as well as hyperdilute Radiesse or CAHA. So using all of these in combination, we can really start to restore the face. Ideally, before people start on their Ozempic or their Mounjaro or Zepbound or whatever product they're using to adjust their weight, we like to start along the path of everybody's weight loss, because in that way we can use energy-based devices to address tissue tightening as well as to stimulate more collagen formation, and at the same time encourage these people who may be kind of starving themselves to follow a better diet. This is the combination solution that I presented at What's My Treatment here at Maui Derm. Another topic is looking at the laxity of the neck. We all know the usefulness of the energy-based devices for approaching the laxity of the neck, but it turns out that using an off-label polylactic acid hyperdilute formula injected straight into the dermis optimizes the effects of this product, and you can actually get significant tissue tightening in doing anywhere from 2 to 4 treatments of a very superficially administered hyperdilute polylactic acid. And this is using a needle, because a cannula will not go through the dermis, and it's below the dermis, and we like to deliver the product exactly where the fibroblasts are. Another way to optimize this is to rejuvenate the fibroblasts by an earlier, some kind of a treatment, whether it's microneedling or whether it's a very light fractional resurfacing or even a chemical peel, because we have learned that these senescent fibroblasts need to be restored so that they can really function as well as we want them to in creating more collagen and elastin after a treatment like that. Then the third issue that I presented was trying to figure out another type of product that could be applied to the skin using some of the newer technology, which is really just pressurized force, such as the TED device, and also a device called the Energet, which can deliver insulin to the very top layers of the skin. So using a relatively small amount of insulin applied across the face, you get a shockingly rejuvenative result. And the reason for that lies in some of the physiological pathways of stimulating the insulin-like growth receptors. So these are just some of the novel approaches that we're using in my office, and I presented here at Maui Derm to improve all of our practices and give incredible results to our patients.